Hey guys, so today I thought I would talk to you a little bit about ear infections. Chiropractors' kids don't really get ear infections. The only time one of my kids had an ear infection was when my daughter was 2 and she was refusing to let me adjust her and was really wiggly and just wouldn't sit still, and she ended up with an ear infection. But I worked on her and within an hour she went from screaming in pain to totally fine. There are some things that you can do at home, and that's what this video is about today. So I want to show you what you can do when your child has a middle ear infection. A middle ear infection is usually caused by a virus, so antibiotics are typically not going to help. If there's an outer ear infection or swimmer's ear, that one is more likely to be bacterial, but the middle ear infections are what I'm talking about today. So one other thing to know is if there's a child who's getting a lot of ear infections, one thing that I tell parents to try is taking out dairy for 3 months. Even if there's not a dairy allergy, dairy, the way that it's processed today, can actually clog up our lymphatic system. It produces a lot of mucus, and so sometimes that is the cause of chronic sinus congestion and chronic ear infections. If you do know someone who has a lot of ear infections, that would be a great person to send our way, because there are some things that we can do in the clinic that help quite a bit. But I'm going to show you something now that you can do at home. There are 2 different procedures that you can do to help drain the eustachian tube. In kids, that eustachian tube that goes from the ear and it actually drains into the throat is more horizontal. In an adult, it's more vertically positioned, so it drains easier in an adult, which is why kids tend to get more ear infections than adults. But this procedure I'll show you helps to drain that fluid if they have the middle ear infection. So what you do is just get a little bit of olive oil, and you get that on your thumb so that you can slide easily on their skin. And what you're looking for, I have my son, my 6-year-old here helping me out today. What you're looking for is if you look behind the ear, and have you turn a little bit for me. If you look behind the ear, there's this bone right back here. You're not going to be on the bone, you're actually going to be in front of it. So you're going to be between the ear and that bone. And then if you feel down here, you can feel their jawbone, and you're going to be just behind the jawbone. So you're going to take your thumb and you're going to run it down that line behind the jaw here, and you're going to do that several times, about 10 times in a row, and do that maybe 3 times during the day, and that will start to help drain some of that fluid out. The second thing that you can do is you can actually pull down gently on, let me see if I can get you in a better position here. Okay, you're actually going to pull down gently on the ear itself, again using some oil and massaging. You can do it with both ears if you want. So pulling down on the ears by the earlobe there. There's some pressure that I'm using, but if they do have an ear infection, you want to be pretty gentle because the ear will be sensitive. So you can do that earlobe pulling down and massaging for about 5 minutes, and that'll really help to drain things out too. So that's it. Hope this is helpful. If you know someone whose kids are getting a lot of ear infections, invite them into the group so that they can view this video as well.